He said, "What's your dream job? Like, what do you want to be doing?" I said, "I want to work for the coalition. I want to work for the healthcare coalition." He goes, "Then do it." I said, "It doesn't exist. They didn't employ people at that point in time. It was all voluntary. There was no job there in the coalition." Before we became a regional coalition, people really operated in silos. And that served a purpose. It built our local foundations. Those are very strong now, and that's where you have to start with response. But what we've done regionally is broaden that quite a bit. Our coalition currently has over 400 members in it within the region, and so we see those relationships being built all the time. In meetings, outside of meetings, we do social events. Here in this region, we've been lucky that we have a strong foundation, and so it takes a lot for us to get overwhelmed, but if it should happen, we are ready. The vast majority of the planning that we do really can be tailored to any type of event. There's obviously some specialty events that we have to really look at and kind of drill those down, but the goal is that our overall planning processes and relationships can really be implemented, whether it's a wildfire, an active shooter, or a communicable disease outbreak. That's kind of the approach we take. We really want a lot of that boots on the ground work to really happen at that local level. And so we will support that as needed. But again, it's anything that really overwhelms the systems that exist, and they need additional support when we're talking regional. One of our top hazards within this region is communicable disease or disease outbreak. And so should that hit our region, we will be working very closely with public health as they would be the lead in that. In many of our EOCs, or emergency operations centers, which are run by emergency management, our public health partners fill what we call the emergency support function 8, and so it's health and medical. And so they would step up and meet the needs of those healthcare providers within that area. If they need resources or supplies or support in other capacities, they would respond to those requests. Even outside of a large-scale disaster, right? You're building relationships in the coalition. And so even on a day-to-day, that's a positive thing. We joke and say, you don't want to shake hands with somebody for the first time during a disaster. You want that relationship built so you can work with those partners and collaborate to respond effectively and meet the needs of a community during a bad day.